I'm pressing record.
Hi, everyone. My name is Adrian Benest. I'm the Education and Community Liaison at the Nanaimo Brain Injury Society. Today, we're welcoming back Jan McNeil for a part 2 on anxiety and traumatic brain injury. So welcome back, Jan.
Thank you.
Yeah, we had so much information and thought that this would be a great part 2 to kind of add to our first presentation, which was on depression and traumatic brain injury. So I will let you dive into this topic.
Great, thank you. And if those aren't interested in watching the TBI and brain injury, you don't have to. This one's going to be on anxiety. They present alone. So I'll just let you know a little bit. So I'm Jan McNeill. I'm a registered clinical counselor here in Nanaimo. I'm part of Covalent Health Consulting. And I've been a counselor now for almost 20 years. I worked over at GF Strong, where we have the BC and Yukon main center for people with brain injuries as well as spinal cord injuries. And that's a bit of my background. Okay, so today we're talking about brain injuries and anxiety. So it's important to recognize that brain injuries and mental health basically go hand in hand. And in some research ones, you can see that it has 1 in 5 can experience. So that's about 20% can experience some kind of an issue. As some studies, it goes as high as 60% can have issues with mental health. And anxiety is definitely one of the ones that can increase or can be impacted by a traumatic brain injury. So again, what are we talking about when we're talking about mental health? Well, it's our mood and how we're able to regulate or how we're able to cope with our emotions. Do we have like no control over them? Do we have a little bit control? And also then our behaviors. So if we're not feeling so good or we're feeling really anxious, we're going to behave in certain ways. So it's important to also understand that brain injuries can actually make an existing mental health issue worse, or it can make it better. Because in some instances, the brain injury can make it so that you are not feeling depressed or anxious, whereas before, but most of the time you'll end up developing some kind of a mental health issue if you have a pre-existing one already. Okay, so just make it a little bit worse. So here's a really nice sort of screen where it says you can have your brain injury, you can have a mental health disorder, but then oftentimes there's an overlap, if that makes sense. And so in that overlap, what can happen is those symptoms can be reduced or can be exploded in terms of magnified to make them worse, or it doesn't. Okay. All right. Anxiety and brain injuries. So anxiety was found in about twice more often in our samples with people with brain injuries than in the general population. So they're twice as likely than someone without a brain injury to develop anxiety. Okay. So what exactly is anxiety? You always hear this talking about people, what is anxiety? People have anxiety, people don't. So anxiety is a feeling of fear or nervousness that's out of proportion to the situation. So it would make sense that if you had a bear approaching you, that you're going to be anxious. And that would be a full-fledged response. But to think about going outside and being in public, that should not give you that same intense reaction as if you're facing a bear. That makes sense? So people with brain injuries can actually feel anxious without actually knowing why they're feeling anxious. They can just have this sensations, and we'll talk a little bit about the sensations in a bit. Or they may worry and become anxious about making too many mistakes or failing at a task, or if they feel they're being criticized. So oftentimes, your before self and your after brain injury can be different. And you may not be able to do things as well as what you did before. And so now you're worried about making mistakes and how that might look, or people criticizing you because you're making mistakes, or you're not able to complete a task or to do a task, or you forget about the task completely. And so you end up failing at it. So this can create your anxiety because you then start to worry about the next time you're going to do, or you start criticizing, okay? And your brain just starts to play, and it doesn't stop worrying. So here's a nice sort of description about just regular anxiety and an anxiety disorder. So as we talked about, anxiety can be a normal reaction to a stress or difficult times. So if you're going to go and present, you're probably going to be anxious. If you're going to be going and meeting someone for the first time, you might be anxious, okay? Anxiety disorders, the anxiety can come out of nowhere, sort of for no reason, okay? And it can be an intense or not appropriate emotional response to the situation. Regular anxiety is usually triggered by a specific stressor. Okay? It usually also has a start and an ending point. So once that bear has gone, or once the presentation is over, or once you've gotten to know that person, the anxiety comes down. Whereas in an anxiety disorder, it goes on and on and on and can last for weeks or months, that anxiety feeling. It can also interfere with your day-to-day life. So you might feel too anxious to go outside because you're afraid that you're going to say the wrong thing, or you're not going to remember something, or an interaction that you had with someone the other day replays over in your head. Some anxiety can actually be helpful because it can actually motivate you to do something. But if the anxiety gets too big, it actually stops you from doing something. So that's when we consider it a problem and a disorder, okay? Anxiety will often just lessen significantly or disappear when you're away from the stressful situation, okay? And you often will feel better if you start relaxing. Whereas anxiety disorders, that physical symptoms like sweating, trembling, lightheadedness, racing heart, it feels impossible to control or manage, okay? But we know that there are some strategies that we can do to help us calm ourselves down. And regular anxiety is a response to a challenging or a toxic situation, okay? So hopefully that helps to sort of clear up the difference between the two. So what can influence or cause anxiety after a brain injury? Well, as we talked about a little bit before, you can have difficulty concentrating, and you can also have difficulty reasoning or understanding. It can make it hard for the person with a brain injury to actually solve a problem. It can kind of feel like you're stuck, or just sort of you can't come up with any solutions. So this can make someone feel overwhelmed, especially if you're being asked to make a decision in a timely manner, okay? Or any kind of decision. And you're being put on the spot and it's just like, oh my gosh, I can't make a decision. Brain can go blank, okay? So it can also happen with anxiety if there are too many stressors on you, okay? So if you're being expected to return to work too soon or to school too soon after your injury, it can just start to feel anxious, the overwhelmed, the physical sensations can just feel so too much, and it's just like you're vibrating. So the time pressure can also heighten. You feel like the clock is ticking, okay? All right. So situations that can require a lot of attention to detail, or even just attention to anything, and information processing can make people with a traumatic brain injury feel really, really anxious. So an example might be, somewhere where you're out and in a really crowded environment where the stimulation is just too much, Or when you're out driving and there's too much traffic. I've noticed that there's getting a lot of traffic around Nanaimo, and for a lot of people that can just be overwhelming. Or perhaps there's noisy kids around and you just can't focus or concentrate because there's too much noise. Okay, so let's look at an example. So if you were in a situation where you had all of these people lined up and you were the only person on the other side, and all of these snowballs started to come at you, you would feel a little overwhelmed and you would want to sort of shut down and hide. Okay? If you had only a few kids, few of them come back, your brain can handle, you cannot feel quite so overwhelmed and shutting down. But there's still a little bit of anxiety. Okay? Or if it was just one-on-one. So this is kind of like your brain. When there's too much, when you have that whole line of people thinking about, throwing the snowballs, that much stimulation is overwhelming with the brain, and it's going to shut down, or it's going to create an intense anxiety when you're out and you've got tons of people around. To when you have just a few people, you may still experience some anxiety, but it might not be so overwhelming that you just shut down and can't think. And so often people with brain injuries will be less anxious in a one-on-one setting because they can think clearer, they can focus better than being in a big group. And this is, as we just saw, an example as to why. So hopefully that makes sense. I know it certainly increased my anxiety thinking about that whole row of people throwing snowballs at me. Okay, so what does anxiety look like sometimes? For some people, anxiety can be so overwhelming, you actually get angry and you kind of blow up, okay? Some anxiety makes you want to shrivel and kind of hide and sort of lower your head and not sort of be exposed anywhere. Some people with anxiety actually just want to numb out and sleep, okay? And so you go to sleep because it's just too stressful to face, okay? And then others can actually just cry, and anxiety can make them feel very teary, okay, and overwhelmed. Or you can feel super stressed and rigid and tense all over the place. And this is, I like this one. Can anybody relate? Fred, when are you going to learn to relax? You're on the hammock, but you just can't relax because you're so anxious about everything. Okay. So what are we talking about here? So oftentimes what happens is you're going to have something that's going to trigger you. Okay. It can be a thought. It can be that I have a paper due, or that I have to go and do this, or I have an appointment. I keep on forgetting about it. I have to remember, or you've got to go and do something, and you just have this huge arousal, this escalation. So for a lot of times you can have the thought, or it comes and you go straight from 0 to 100, right? Especially with brain injuries, it happens really fast. And it's like you had no warning. But a lot of times there can be a small warning where you can catch yourself. But let's say you don't. You go up to that point where it's 3, where it's crisis, where you end up with that, the little in and out dude where he's the angry one, right? Or that shriveling, nervous one, or you just want to go to sleep, kind of avoid it, or you just get so overwhelmed and anxious you start crying. So up here is when you're in the crisis where you're just not thinking clearly. So if we're up at that point, our ability to think clearly actually goes down. So you can see the bottom of that sort of lighter blue line. As you're up at your top in your crisis, you don't think clearly. And then after you've sort of had that explosion, oftentimes you'll start to come down in your arousal. And that's where you can almost, that number 4 is recovery, you kind of get into that depression, you're exhausted. And then you start beating yourself up because of all the things you said or did. So this is an important time to sort of rest. And then afterwards you come back to neutral, right? And as you're coming back up, your ability to think clearly starts to come back online. So what we want to do is, as we go up that sort of arousal cycle, we want to do some strategies, or have some strategies to help lower us down. Okay. So instead of becoming blah, or if we're at there, what we want to do is we want to learn strategies help bring us down faster. Or even if we start to think about, okay, I know I have to leave the house and I'm getting super anxious. What can I do to bring myself down? Okay. So oftentimes, what can it feel like? Let me move this. Basically, in your head, you've got all these thoughts going on and it feels crazy. The other part that you can feel is you can actually feel like you're going to throw up with anxiety sometimes. So you can have that physical sensation of literally wanting to throw up. Or you can feel like you have butterflies in your tummy. Okay. And it can just sort of be there, sort of kind of a tingly feeling in some ways. And then sometimes you can actually, your anxiety can make it so much that your hands start to fist and you're just feeling overwhelmed because you just want to control it somehow. Okay. Or you can feel like your legs are really shaky, right? Your just legs are wobbly. They kind of feel like they're going to go out from underneath you. Okay. Or you can end up sweating a lot. You can feel like you sweat with anxiety. Okay. All right. So what can be done? Let's move us back over here. Okay. So what we want to do is we want to reduce, so lower the demands, whether or not that's in our environment or any unnecessary stressors that might be causing anxiety. So we basically want to simplify our life. So instead of taking 3 courses at school, you take 1. Instead of doing groceries and walking the dog and going and visiting friends or doing something like all these things, just too many demands on your day or too many appointments, slow it down. Just keep it simple. If you're with someone that suffers from anxiety, we want to help them to calm them down, but we don't want to tell them to go and calm themselves. We want to do things with them to help reduce their feelings of anxiety. So, what are some things that we can do? Medication is a place that some people like to start, and others like to do this as a last resort. So, if you haven't seen the stuff we talked about in the depression, this is similar to what happens in depression, is that we have these things called neurotransmitters that are in our brain. And they're essential for helping ourselves to regulate, okay, our moods. So it's not just depression that it helps to regulate, but it also helps to regulate our anxiety, okay? So chemicals like serotonin, epinephrine, dopamine, norepinephrine, acetylcholine. Now, remember when we saw that arousal cycle? These are all going to be emitted as you start to get aroused, or as you have those overwhelming feelings of that anxiety. So that angry dude, or that feeling of feeling nauseous in your stomach. These are happening because you're releasing hormones and neurotransmitters in your brain. So what can happen is that if we actually give you some medications, it can help to reduce some of that anxiety. All right. But again, when we take those medications, we also encourage you to get help. So use it in combination with seeing someone or talking to someone. And then when you start these doses, you're actually going to find they're going to start you on a low dose and then increasing it to see how it's effective or not. Okay? So if we've got getting anxiety, we want to either somehow hit the pause button on that anxiety, right? Or we want to somehow stop our thoughts. Some people like to imagine the pause button. Some people like to imagine a stop sign where they basically think, okay, I've got to stop worrying, or I've got to pause on that worry and I'll get back to it later. And we'll talk a little bit about, we're just going to go over some strategies and how to actually do that. Okay. So it often sounds easier, right? Oh yeah, stop sign. But if you find yourself going through and your brain is going through that sort of where it's going over and over and over and over and it can't stop thinking about all these things, sometimes it can be really helpful literally to imagine a stop sign or a pause button. Okay. For those that imagining that maybe not so great, it doesn't work as well, let's then try digging your heels in. So in the one we saw for depression, we did them both at the same time, push them in and then release, push them in and then release. We can also try it alternating. So we can push one in and then release, and then push the other in and then release. And we do this a few times, okay? I always like to do at least 3. I lose track after 3. So, but you know, at least I can count to 3. Okay. So those are some good ones to do, some digging the heels in. So what you can do is imagine the stop sign or imagine the pause button, and then start doing the heel digs, right? We never just want to think doing one. One's never usually enough. We have to do a whole bunch of these things to help us to calm down, okay? So what's the next one? Oh, we did the palm pushes last time too. So you can do pushing the palms together, hold for 3, switch them, hold for 3. And again, I like to do them 3 times each because honestly, I will forget after. So that's 2. And this is the 3rd, I think. But honestly, if you just do it until you feel a bit calmer and then release, and then what are you noticing? Okay. Some people like to do this one, right? Pushing the palms together and then release and see what they're noticing. Okay. Now this is one, it's called a butterfly hug. And for some, what they like to do is you take your thumbs together and kind of hook them, if you can see that, right? You hook them. And then you put them here and you find your collarbones, right? Collarbone here. And you go right underneath your collarbone, right? And you alternate the tapping, okay? So we call these butterfly hugs. And you just alternate back and forth, back and forth. Others like to do it this way, where you just cross your arms, right? As if you're sort of giving yourself a hug and then tapping. Okay. Right. And then after you've done this tapping, it's kind of nice just to go up and down, right? To see how you feel. So you can do this for like 30 seconds, right? Or even a minute to help yourself calm. And what's great, if you do the stop sign or the pause button, you dig your heels in, you do the pushing, and then doing this, and then this, or I find this one hard, but for some that's great. I'm just not that coordinated. Then doing all those in succession, so one after the other, can help you lower your arousal. And then another one is, again, looking around the room, naming things you see, or what do you feel, right? What do you feel texture-wise? Is it rough? Is it smooth? Is it hot? Is it cold, right? Is it bumpy? What is it, okay? And then what do you hear? What noises do you hear in the room? And for some, if you don't hear any noises, think of what your favorite sounds are. For some, it can be waves. For some, it can be the rain, hearing the rain on the roof. For some, it can be a cat purring. For some, it can be their favorite music that can help calm them. Not the kind of music that's going to make you more anxious. So hard rock, banging your head may not be helpful, okay? calming music might be helpful. And then what do you smell? What do you smell in the air? When you go outside and you can hear that smell, that fresh, clean, especially after snow, everything feels so fresh. Or after it's rained, what do you smell? Some people like to smell cookies baking. Some people like to smell vanilla, peppermint, lavender, lots of different kind of smells. And then what do you taste? That sort of mouth taste that you can get, or if you think about your favorite taste of cookies or chocolate, or for some, they love to taste lemons. That can help them feel good and calm. Okay. So remember, we're doing all of these, okay, over and over again. And then, of course, exercise. My goodness, exercise. Exercise is really good to help with anxiety. And they actually say that if you do it in the morning, the exercise can help you feel calmer throughout the day. So again, we want to do something that's going to be doable. We don't want exercise. I'm going to lower this because I don't know if you can see my little yoga dude cat. All right. So we want to make sure it's doable. So if you haven't been exercising for a while, how about you walk outside for 5 minutes, turn around and walk back for 5 minutes, and do that 3-4 times a week. The next week, let's increase it to walking out for 10 and turn around and come back for 10. Okay. We're not talking just a slow, casual pace. We're talking just, a good sort of pace. You work up a little bit. And then we want to work up to anywhere between 20 to 30 minutes, 3, 4, 5 times a week, whatever. We know for a fact exercise helps to produce healing and healthy chemicals in the brain. So if nothing else, helping yourself to do exercise in the morning, especially for anxiety and depression, can actually help you feel a little bit differently, okay? And I know right now is not a great time. You can't really do any volunteering or activities, but there are things online that you can do in terms of support. There's support groups. I know you can do peer one-on-one stuff online. And again, anxiety can be helped by certain medications, by doing some counseling with someone who's familiar with TBIs, or combination of medication and counseling and exercise. Exercise, exercise, exercise. And it doesn't have to be like for an hour, just a short period of time. What not to do? I'm learning how to relax, doctor, but I want to relax better and faster. I want to be on the cutting edge of relaxation. That's not helpful. Okay, let's just put it out there. Not helpful. We just want to do it a little bit at a time. So what are some relaxation techniques? So the progressive relaxation is when you squeeze your muscle and then relax. Okay, squeeze your muscle and then relax. So you can go from your head all the way down to your toes, or you can go from your toes all the way up to your head, squeezing and relaxing different body parts. Okay. And again, we've got that deep breathing. So putting one hand on your chest, one hand on your belly, and you want to breathe through your belly, not your chest. Okay. You can do some visualizing. You can listen to some relaxing music. Laughing is awesome way to help relax. And then some people like to do Tai Chi or Qigong. Okay. You can check any of these things out on the web. Okay. So why does the relaxation response work? Well, it actually decreases your metabolic rate, and it actually helps you to have a better intake of your oxygen. It will slow down your analytical thinking. And so when we get into that anxiety mode, we're trying to analyze everything. So by actually doing some breathing and helping the relaxation response, it actually slows that down. You have increase in skin resistance, increase in alpha wave brain activity. Everybody wants some good alpha waves. Decreases your heart rate, It decreases your respiration rate, your blood pressure, and your muscle tension. So all those things are good for you. Okay, and again, there's some really good apps, especially for anxiety and depression. And so I've put a few on here as links for resources and tools. Okay, so places that you can look up. But the most important thing to remember about anxiety is if you can practice these kind of grounding techniques several times during the day or when you feel anxious, then you will get better at it and it will be easier and you will find yourself relaxing more and more and having less and less anxiety. And if none of those are working, make sure you see your counselor or you talk to your doctor, and maybe medication might be helpful for you. Okay? And then thank you. That's it.
Thank you very much for joining us again. I really appreciate having these resources to populate our YouTube channel, which is, you know, a great thing for clients to come back and visit and practice over and over again. So thank you so much for volunteering your time. We're lucky to have you in Nanaimo. It's such a great resource. We hope to see you soon, maybe in person next time.
Great.
Fingers crossed, but thank you for joining us and we will see you on the next one.
Okay. Thanks again for everything, Adrian.
Bye now.
Bye. And I have to figure out how to stop recording.